talking about HIV. Still a really big issue right now. I don't know what we're going to do about stigma. Stigma, we can't get rid of it. I wish we could just give it a kick so that we could, because most of, I think the biggest problem with HIV is stigma. But we are talking about mother-to-child transmission, and joining me in the studio, Dr. Mushavi. Now, for a lot of us, we don't understand who the transmission is exactly. When is HIV transmitted to the baby?
So when the mother is pregnant and she's carrying the baby inside the womb, the HIV virus can be transmitted during that time. Even if it is not transmitted during that time, there's also the risk when the baby is coming out of the birth passage that transmission can occur. And even if it doesn't occur around that time, there's also the risk in a woman who is going to breastfeed her child that the virus may be passed on to the baby through the breast milk. So those 3 time points are very critical. Now we recommend, for interventions for preventing transmission to the infant, that the mother, as soon as she knows that she is pregnant, as early as possible, she must come into ANC, antenatal clinic, and then she can have HIV test. She's not only going to get HIV test, she's also going to be tested for syphilis. She's also going to have a blood check to make sure her blood is okay. We also do blood group for women that are pregnant. So we do pregnancy care, but over and above that, we also do an HIV test so that we know if the mother is HIV positive or not. And we can give antiretrovirals to women who are HIV positive. She starts that medication as soon as we know that she is HIV positive. So whether she comes in 6 weeks into the pregnancy, 12 weeks into the pregnancy, some people come very late, 30 weeks or 7, 8 months, they come in for the first time. At whatever time the woman comes in, she will start lifelong antiretroviral treatment to keep herself alive. And importantly, that reduces the virus in her blood so that the baby is less likely to be infected.
We just also want to say, Kuti, ignoring the situation or trying to deny what is there is HIV is out there. So it's not about looking at how you got it, who you got it from, where you got it, but it's saying, Kuti, look, it is out there. Just make sure that you, the baby, your family, you are okay. So encouraging all pregnant women out there to go out there to my clinics. We were having this conversation last week, Dr. Mushavi. Are these tests available at all the clinics again?
They are available. Even in the remotest of rural communities, HIV testing services are available. Now, one of the things that people always say is, when should I get tested? We are talking now of a woman who is already pregnant. But let's step back a little bit to the woman who has not yet decided to have a baby. Our approach is certainly for young girls, young women who are going into marriage. It is so important to know your HIV status. Even if you are HIV positive, before you fall pregnant, you can actually go on lifelong antiretroviral treatment. And that places you at very low risk of transmitting that baby when you eventually get pregnant. So preconception, that's why I say this is important even for girls, for young women, for couples planning families, to know their status even before they have that pregnancy.
And we are in 2017. It means that we have we have a lot of young people who are some were in some cases born with the disease.
Yes.
So you need to be conscious of that. And like I said, it's not about how or where or who you got it from now. It's about, protecting your life, protecting your family. So we need to encourage each other. I was reading the paper yesterday. We actually have a lot more teenagers who are on ARVs. So let's all be conscious. it's an uncomfortable conversation to have. Isn't it also a good idea for the men to accompany their wives kana agenda for these tests, even when they're pregnant? As Africans, we tend not to do that, but it's important.
Yeah, you bring in a very interesting perspective, because for antenatal care, even for the prevention of transmission to the infant, we very much want pregnant women to come in with their male partners. And then we can do what we are calling couples HIV testing services. So the couple can both be tested at the same time in the same clinic by the same provider and can receive their results together. This helps because what we have seen in our program in terms of males coming in with their female partners is a very low proportion of about 23–24%. So only a quarter of women who come into ANC bring in their male partners. That is very low. That is very low. We want all men to accompany their women and access services for testing. It helps because what we have seen, when a woman tests alone and maybe she tests HIV positive, when she goes back home to inform the male partner, then it's an issue. Yes. Because then the man thinks, On the other hand, if the female tests alone and she's negative and she tells the male partner over status yako ndoya. But it's not like that. No, it's not like that. You can have situations where the woman might be negative and yet the man is HIV positive. Those are serodiscordant couples. You can also have a situation where the female tests, she is HIV positive, but maybe the man is HIV negative. Because, people have had relationships before they get into a union, isn't it?
True.
And you never know the relationship that you had, whether you remain negative or not, particularly if you are not regularly testing.
0731168045, that is our WhatsApp. Stay tuned. Don't go anywhere.